For all the latest updates, subscribe to News9.
Karnataka has seen a doubling of COVID-19 cases in the last 10 days. The fatality rate has also tripled in the last 5 days in the state. Nearly 74% of the deaths due to COVID-19 in the state are among people who are above 51 years. Highest number of deaths have been reported in the 61 to 70 age bracket, with majority of them suffering from severe acute respiratory infection and influenza-like illnesses. No deaths were reported among those below 10 years. The State War Room has analyzed the data of 1,403 deaths that were reported till 20th July and 311 deaths were reported in people aged above 70 years. 378 deaths were reported in people between the age group of 61 to 70 years. 349 deaths were reported in people between the age group of 51 to 60 years. 214 deaths were reported in people between the age group of 41 to 50 years. 100 deaths were reported in people between the age group of 31 to 40 years. 49 deaths were reported in people between the age of 21 to 30 years. 2 deaths were reported in people between the age group of 10 to 20 years, and no deaths were reported in children below the age of 10. Most of the patients who passed away were those who had comorbidities or a weak immune system. People who are now going out to work should not come in close proximity with their elderly parents. They should isolate them if they are above 60 and particularly if they have comorbidities. They can be asked to stay in a separate room or separate floor until the number of cases being reported reduces. Karnataka's contact tracing has dipped from 47 per patient in June to 6 primary contacts in July. The drastic drop is a pointer to the collapse of the contact tracing process. It was in the first week of June that Karnataka, especially Bengaluru, rode high on effective contact tracing and won accolades from the centre. The brainchild of IAS officer Munish Modgil, the contact tracing mechanism helped keep the count low. But with Bengaluru Civic Agency caught napping when the unlock happened, the system simply collapsed in the city. In the past 10 days, Bengaluru has seen a COVID explosion of 17,000 cases, and we have moved from being a state with highest per patient contact tracing to one of the lowest. BBMP, on the other hand, aims to conduct 20,000 tests to combat COVID-19. To fill the gap of inadequate rate of testing, the BBMP is planning to conduct 10,000 rapid antigen tests per day. 10,000 reverse transcription polymerase chain reaction tests will also be conducted in a day.